South Africa is on the edge of an economic abyss. Unable to manage the coronavirus crisis on its own, the IMF has agreed to put forward $4.3 billion to help rescue the country.
Going forward, our fiscal measures will build our policy strengths and limit the existing economic vulnerabilities, which have been exacerbated by the COVID-19 pandemic.
Africa's most industrialized economy was already in recession before COVID-19 hit, but the pandemic has made things much worse. The number of jobs in the non-agricultural sector fell by 0.2% in the first 3 months of the year, and total unemployment hit a record high of more than 30%. The government expects the economy to shrink by 7.2% this year, its deepest slump in 90 years, and projects public debt to peak at 90% of GDP in the next 4 years. With more than 445,000 confirmed COVID-19 cases, South Africa is the worst-hit country on the continent and has the 5th highest number of cases globally. Lockdowns imposed in March have made it harder for residents to make ends meet. Some restrictions were loosened last month, but a new rise in infections has brought back partial curfews and a ban on alcohol sales. That's made life particularly hard for hospitality workers.
The whole situation has affected me both financially and emotionally. Financially in the sense that I can't afford my housing where I stay, I can't afford to feed my kids.
We currently estimate that 30% of restaurants have already closed their doors. Of the 70%, 50% of those restaurants really don't know if they'll ever be able to open their doors.
President Cyril Ramaphosa announced an aid package of nearly $30 billion in April. But many workers here say they still haven't received any money from the government's unemployment insurance fund, which itself has recently reported fraudulent payouts. A recovery from the pandemic will be difficult enough. But with the ongoing corruption, analysts say it will take even longer, and the worst is yet to come. Sibel Karkus, TRT World.
Let's get more on this now with independent economist Thabi Leoka, who joins us now from Johannesburg. Welcome back to the program, Thabi. Now, the IMF's loan is the largest that any African country has received since the start of this pandemic. How badly does South Africa need this money right now?
Good evening and thanks for having me. So South Africa desperately needs this IMF funding to help with their COVID-19 relief. So initially, the president had announced 500 billion rands towards COVID relief, and part of that money will come from the IMF and other multilateral organizations. As your clip showed earlier, many of the companies in South Africa have not received the funding that they were supposed to receive, and also many of South Africa's citizens who are unemployed have not received the support that government had initially said they would receive.
Yes, as you say, this massive relief package worth $30 billion was announced by Cyril Ramaphosa back in April. What's holding up the disbursement of these funds?
There was a lot of corruption in the UIF, which is the unemployment fund. And many people and companies were basically trying to get more money than they ought to, or they should have received. And also, I think that they had put a lot of restrictions. So, for instance, for the small and informal sector, they had initially said that they needed to have been tax compliant, they needed to be South African citizens, etc. So there were a lot of restrictions before people could qualify and companies could qualify to get the funding. But just, the whole system was just not working efficiently. And hopefully with this added funding and the mistakes learned from the past, that funding will then go to the right people.
And as we also heard in Sibel's story there, South Africa is now the country with the 5th highest number of coronavirus infections in the world. How is the government handling the fact that we're seeing such a sharp rise in cases ever since that lockdown was lifted?
So initially, we did go into a very hard lockdown, and we were lauded by the World Health Organization for taking the right steps and being very strict in terms of lockdown. But it was very difficult to then remain at that level 5, which is what we had as a hard lockdown. It was very difficult to remain in level 5 when the economy was really underperforming, unemployment was rising, and it was there was a lot of pressure to open up the economy, and that's when we started to see a spike in infections. So right now, fortunately for South Africa, unlike many countries that have a similar rate of infections, our death rate is one of the lowest compared to the countries that have similar rate of infection. So we have just over, I think, 6,000 cases of death, but we are approaching our peak. Our peak is now expected to be around July, August to the month of August. So this number, the 6,000, we are likely to see more deaths. It's going to be very difficult for the government to contain this, but we are hoping that they will be able to contain it and put in place measures to ensure that people are not, the system doesn't break, that the system actually can sustain those who are infected and affected.
Okay, Thabi Leoka in Johannesburg, thank you again for joining us on the program.